So what might be blocking Democrats from using reconciliation to create Medicare for All to fight COVID? Good question. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel.
Oh, hi, Tom. Yeah, I wondered why can't, in this, as part of the recovery plan, why don't the Democrats just, go full bore and ask for and put in the plan a single payer plan or Medicare for All to relieve the pandemic, because of, when you think of the long haul effects and all the people that have been affected by it or may in the future be affected by this or variations of it. Is there a way that they could just put it in the bill and pass it?
Ricky, you have identified something that in theory makes perfect sense. Budget reconciliation, they have basically one chance, arguably two, but definitely one chance to pass one big piece of legislation with only 51 votes, with 50 votes plus Kamala Harris. And it has to be done through a process called budget reconciliation, which means that the parliamentarian of the Senate has to agree that every single item in that bill has a direct impact on the budget. And Medicare for All would certainly have an impact on the budget. And I think it could be passed by reconciliation. The downside, of course, is reconciliation. Anything passed by reconciliation automatically expires in 10 years, first of all. Although I think that it would be renewed because by then it would have success. But secondly, the problem that the Democrats have, or that Chuck Schumer has right now, is that there are a few Democratic senators who are not in favor of Medicare for All. So if you were to put Medicare for All into this, $1.9 trillion bill and turn it into a, $5 trillion bill or whatever, you would lose Joe Manchin almost certainly, Kyrsten Sinema, and perhaps a few others. I'm thinking there's probably at least 5 or 6 so-called conservative Democrats who are taking so much money from the health insurance industry, the hospital industry, the physician industry, the medical device manufacturers industry, and the big pharma industry, all of which collectively have something like 3 dozen lobbyists per senator, that it couldn't pass. And so they wouldn't add it in because they're afraid that that would blow up that bill. Does that make sense?
Well, what if they put it in and it didn't pass, and then they just reintroduced the whole thing without it? How hard is that?
Well, I think right now what Schumer and the Democrats are looking at is that 1 in 6 children in America, 1 in 6 children who live in a rental household, are going to bed hungry right now. Some numbers indicate that it's 1 in 5. We've got at least 10 million people who are unemployed simply because of COVID. We're adding about 1 million people to the unemployment rolls every week. And there's a crisis. I mean, just a screaming crisis. People are losing their homes. They need to extend the moratorium on foreclosures and things like that. And if they don't do this stuff soon, there's going to be just an absolute human disaster. And I think that they would be accused of basically, playing politics. So, that's my thought. Those are my thoughts on that, Ricky.
I thought because they didn't pass one last year, they had 2 that they could put through this year. They may.
And if that's the case, then, Medicare for All and a few of the other wish list things on the Democratic agenda would be great. Because I'm with you. Medicare for All does tie into this pandemic. People are getting sick. They're running up huge hospital bills that they can't afford. Ricky, thank you. We'll be right back.